Hello, I'm Dr. Peter Leo. I'm a clinical assistant professor of dermatology and pediatrics at Northwestern University, Feinberg School of Medicine in Chicago, Illinois. I'm also a founding partner of Medical Dermatology Associates of Chicago. For a very long time, there was a real dearth in innovation for topical therapy and systemic therapy for atopic dermatitis. We know that our topical corticosteroids first came out in the 1950s, and then there was a very, very long pause where we had any new innovation. Really, one could argue until around the turn of the century. In 2000 and 2001, we had a big breakthrough with our topical calcineurin inhibitors. And then it wasn't until 2016 that we got, again, our first new entry into that entire area of topicals for atopic dermatitis with crisaborole. Well, I'm happy to say last year in September in the United States, we got our first topical JAK inhibitor in a very nice cream base. And that has been a bit of a game changer because now we have another option. And in particular, we have a pretty powerful option that I would argue is comparable in its clinical efficacy to a mid-potency corticosteroid, at least in my experience, and has a relatively good safety profile and is extremely well tolerated. At the same time, we got just a few months later, two new oral JAK inhibitors. And this is incredibly exciting to have finally some oral formulations of systemic medicines for moderate to severe refractory patients, in particular those who have failed other systemic agents. And I have to say, given the population these are targeted for, they have been transformative for many of my patients. These are people that really have failed basically everything on the list up until and including immunosuppressions that are the conventional immunosuppressant class. And so now we have some medicines that are once daily and incredibly powerful and work incredibly rapidly. The trade-off here is that the entire class of JAK inhibitors, and this includes the oral ones, but also for better or for worse, it's also placed on the prescribing information of the topical formulation. They all have the potential of certain side effects, and they all have this black box warning. And in particular, some of them can be a little bit concerning, things like malignancy and major adverse cardiovascular events and thrombosis. But I think what we can do with our patients is that we find these are not insurmountable. For the right patient, we can explain that, yes, there are risks, these are powerful medicines, but that with the proper monitoring, with the proper patient selection, asking the key questions for history, I really think that for the right patient, these can still be a wonderful fit. In my experience, they've already been incredibly helpful for so many patients. Now, they're not perfect. And I think, again, we have to be very clear with the patients. And that's really where the shared decision-making comes in. I want them to be fully open. I want them to be involved in that process. And ideally, I never want to push it on a patient. I want a patient to tell me, I want to try this one. That's the moment I know we have the highest chance of it working. And I also feel like because we're in it together, anything that comes up along the way, we're going to be able to tackle together.